skill is for administering a vaginal medication. So first I would check the MAR for the right medication, right patient, the time, dosage, etc. I would identify the patient and obviously ask permission to give the medication. I would knock on the door, identify myself, identify the patient, and provide privacy for the patient. Close the door, pull the curtain, explain the procedure that is about to happen, and make sure they're comfortable with that. I would have the client use the restroom beforehand. They should void before the vaginal medication is inserted. So then I would put on clean gloves, again, after washing my hands, and position the client on their back with their knees and legs bent and spread apart. Then I would remove any kind of wrapping or foil that the medication is wrapped in, if there is any, whether it's a suppository, a tablet, and insert the applicator. The applicator may be used each time the medication is administered for this specific patient only. I apply a small amount of lubricant to the suppository and tablet and the tip. I would separate the client's labia, with my non-dominant gloved hand, and insert the applicator 2 to 3 inches along the back wall of the vagina. Gently depress the plunger, pushing the suppository tablet into the vagina. If I'm administering vaginal cream, then I would fill the applicator with the client's tube of cream, separate the labia again with your non-dominant hand, insert the applicator 2 to 3 inches along the back of the vaginal wall, and gently depress the plunger, pushing the medication inside the vagina. Remove the applicator, wrap it up in a clean paper towel to be cleansed. Afterwards, wipe away any excess lubricant from the genitalia, and remove my gloves and throw them away per facility policy. I would assist the client to a comfortable position afterwards and ask her to please stay on her back for at least 5 to 10 minutes, helping the medication to stay in and not seep out or come out. And then I would replace the cap and onto the cream of tube and tighten it up, and store the medication according to the policy of the facility. I would then put on a new pair of clean gloves and take the applicator to the sink and wash the applicator with soap and water, dry it and store it according to the policy for future use with only this client. This client is the only one that can use this applicator and tube medication. Remove my gloves, throw them away per policy of the facility, wash my hands, and then go back to my med cart and document that I have administered that medication.